Sarah's hands trembled as she stood before the cosmetics display, her heart racing with a familiar mixture of anxiety and anticipation. The small lipstick tube seemed to call to her, despite having no need for another shade of red. This wasn't about want or necessity. It was about an overwhelming compulsion she couldn't control. Sarah suffered from kleptomania, a complex psychological disorder that affects millions of people worldwide, yet remains widely misunderstood by society. Kleptomania is classified as an impulse control disorder characterized by the recurrent inability to resist urges to steal items that are not needed for personal use or monetary value. Unlike ordinary theft motivated by financial gain or personal desire, kleptomania involves stealing for the sake of the act itself. The condition typically emerges during adolescence or early adulthood, affecting women more frequently than men, though it can manifest at any age. The stolen items are often of little value and may be given away, returned secretly, or hoarded without ever being used. The neurobiological foundations of kleptomania remain an active area of research, with scientists investigating potential connections to neurotransmitter imbalances, particularly involving serotonin and dopamine pathways. Some studies suggest that individuals with kleptomania may have alterations in brain regions associated with impulse control and reward processing. The condition often occurs alongside other mental health disorders, including depression, anxiety, substance abuse, and other impulse control disorders such as gambling addiction or trichotillomania. The psychological profile of someone with kleptomania reveals a complex interplay of emotional and behavioral patterns. Before stealing, individuals typically experience mounting tension and anxiety that can only be relieved through the act of taking something. The moment of theft brings temporary relief and sometimes euphoria, followed quickly by intense guilt, shame, and fear of discovery. This cycle creates a paradoxical situation where the person desperately wants to stop but feels powerless against the compulsive urges. Many individuals with kleptomania are otherwise law-abiding citizens who would never consider themselves thieves. They may be successful professionals, devoted parents, or respected community members living with this secret burden. The shame associated with their behavior often prevents them from seeking help, leading to years of internal struggle and repeated legal troubles. The fear of judgment from family, friends, and society compounds their isolation and psychological distress. The impact of kleptomania extends far beyond the individual sufferer. Families often experience confusion, betrayal, and financial strain from legal fees and restitution payments. Relationships may deteriorate as trust erodes, and family members struggle to understand how someone they love could repeatedly engage in stealing behavior. Children of parents with kleptomania may experience embarrassment, anger, and difficulty forming their own ethical frameworks around honesty and respect for others' property. Treatment for kleptomania typically involves a multifaceted approach combining psychotherapy, medication, and behavioral interventions. Cognitive behavioral therapy has shown particular promise in helping individuals identify triggers, develop coping strategies, and modify thought patterns that contribute to stealing behaviors. Some patients benefit from medications such as selective serotonin reuptake inhibitors or mood stabilizers, which may help reduce the intensity of urges and improve overall emotional regulation. Support groups and family therapy can also play crucial roles in recovery, providing safe spaces for individuals to share experiences without judgment and for families to learn effective ways to provide support. The journey toward recovery is often lengthy and may involve setbacks, but with appropriate treatment and support, many people with kleptomania can learn to manage their impulses and rebuild their lives. Legal consequences of kleptomania can be severe, as the legal system typically doesn't distinguish between compulsive stealing and intentional theft. Many individuals face repeated arrests, fines, community service, and even imprisonment. However, growing awareness of mental health issues has led some jurisdictions to offer treatment-oriented alternatives to traditional punishment, recognizing that addressing the underlying psychological condition may be more effective than purely punitive measures. Prevention and early intervention remain challenging due to the secretive nature of the disorder and the shame surrounding it. Increased awareness among mental health professionals, educators, and the general public could help identify at-risk individuals earlier and reduce the stigma that prevents many from seeking help. Research into genetic predispositions and environmental factors may eventually lead to more targeted prevention strategies. Understanding kleptomania requires moving beyond simplistic notions of moral failing or lack of willpower to recognize it as a legitimate mental health condition requiring compassion, professional treatment, and societal support. As Sarah learned through her own journey toward recovery, acknowledging the problem and seeking help was the first step toward reclaiming control over her life and finding freedom from the compulsions that had dominated her existence for years.